Okay, good morning and a warm welcome to Spotlight on 6 Plus Careers. Please could you introduce yourself?
Hello, my name is Suzy and I am a Neonatal Intensive Care nurse at the North of the Norwich Hospital.
So what does your job involve?
So as a registered children's nurse, I shift work and I have the care of babies from extreme premature babies who are born from anything from 20 to 23 weeks up into babies that are born at term that are sick, and we admit babies that are born poorly or that are planned going to be born early. And it's the holistic care of them and the family throughout the whole period. Some of these babies can stay with us for months, so it's the day-to-day and night care of these babies.
So what has been your career journey to get to this point?
So completed my GCSEs and then went on and completed my A-levels, and then straight from that I went to university to become a child health nurse. Registered with the Nursing and Midwifery Council. I then had my first job on a rotation on a children's ward. So I nursed in both medical and surgical wards in accident and emergency on the neonatal unit at this hospital. And then I really enjoyed my time there on the neonatal unit. So I went on and did another year study to become a neonatal nurse, and then recently moved to work on a neonatal intensive care unit where, like an adult intensive care unit, it's fast-paced, it's modern technology used all the time, and yeah, so I'm now working there.
Wonderful. So what opportunities do you have for career progression?
So to start with, when you qualify, you are on a band 5 registered nurse, and it takes a little bit of time. You need to sort of get your experience. However, once you have got a few years under your belt, there's definitely routes of progression, and it depends what field of nursing you choose to go into. So you can train as an adult nurse, a children's nurse. You can also train in learning disability or mental health nursing. And in those areas, then there's specialities. So I obviously have got into neonatal intensive care, but there's things like research where you can go into and progress up there. You can progress up the nursing ladder, so go into management. But there's also routes into sort of medicine. You can work on the medical rota. You can do modules of further learning into master's degrees, where you complete the things like prescribing, so you can go on and work on the doctor's ward rounds, and some of the colleagues that I work with are actually on the medical rotas of quite senior doctors, but they're nurses, so there is definitely progression up to be able to work in that team if you want to. So that there's lots of different options dependent on where you specialise.
So if you were looking to employ someone within your team, what skills and qualities would you be looking for?
So as a nurse, you just need to be really open, hardworking, good communication skills. Your patients, especially children, you're working with the family as well. So it's all about family-centered care. So you need to be really approachable. Even if you're having the worst day possible, you can't show that. So you have to almost forget about your own life and crack on with your day or night shift. The really good communication skills, just being a friendly, approachable person, hard-working. It is hard work. It's a long shift, and so you need to have stamina to keep going through the night shift. You could be on 3 nights in a row, and they're sort of 12.5-hour shifts, so it's long working and just having the resilience, because despite there being good support around you, it may be that you see things and you're doing things that are quite shocking, or if you're looking after a baby, for example, having palliative care, that's a huge hit on your own mental health. So you just need to have the resilience and the good networking to be able to seek support. And just being a friendly, approachable person. You want to look after the people in your care how you would want your children to be looked after, or your parents. So just need to have that caring, kind nature as well, and wanting to do good for other people.
Absolutely. So what would you say you enjoy the most about your job?
What do I enjoy the most? I think just seeing the difference that you can make to people's lives. It sounds really cliche, but if you really get to know the families of the babies within your care, every day is different as well. So you may be looking after one baby one day, and then you come back for another shift and that baby's deteriorated, or things have gone well. So you see a whole patient journey. So it's lovely when you get a baby that's born sort of 23, 24 weeks, and they're quite sick throughout their journey, but then they keep plodding along, and then you see them discharged. So that whole patient journey is just lovely. It's quite highly skilled as well. So it's something that I probably never thought I'd be able to do, but in neonatal intensive care, you are literally keeping these babies alive. So the medical team will do the prescribing and do the sort of diagnostics, but it's the nursing skills that are keeping these babies alive. So a lot of them are on ventilators. So you're highly skilled in being able to manage the machinery. It's just something that challenges me. But once you've got your head around new technologies or new methods, and you can do it, it's something to be proud of as well. So I like that I'm challenged pretty much every shift, and you're constantly learning. There are a few things.
Lovely. And finally, what advice would you give to your 15-year-old self?
My biggest advice would probably just not to rush any decisions that you make, or to do things on the whim. I think take your time, because especially now within careers, we're working for a very long time in our lives, so you need to be happy in your decisions. So make sure you take your time in making any decisions, and always sleep on things. Don't make rash decisions, so that you can be happy with the decisions you make, because you don't want to rush things and make the wrong decision, would be my advice.